This is my capstone and 5-year plan. My name is Sarah Miller. I'm an RN. My education consists of obtaining my licensed vocational nurse in 2015 and my associate's degree in nursing in 2017, both from Lamar State College, Orange. And I'm also working towards my baccalaureate of science in nursing that I expect to graduate in May of 2019. My experience consists of long-term care for 6 months, telemetry ICU step down for 2 years, CVICU 1 year, and CVICU neurosurgical ICU combined 4 months. My certifications include BLS, ACLS, and TNCC. I also expect to obtain CCRN and CNRN within the next year. Professional organizations that I'm a part of is I am co-chair for the CAUTI committee for the ICU that I work at, American Association of Critical Care Nurses, and American Association of Neuroscience Nurses. Learning objective number 1 practices safe and effective holistic patient-centered care to a variety of patients and clients in multiple settings from a global perspective by incorporating theories and evidence-based findings. I chose an assignment from Nursing 4540, Nursing Practice Care Communities. The assignment I chose is Practicum Project Planning and Windshield Survey, along with the Global Health Discussion. I gave myself 95% on this one. During this assignment, during the Windshield Survey, I was able to evaluate a community that I was not familiar with, interview different places and different people, and see what healthcare options were available in that community for people. And also during the global health discussion, I discussed hepatitis B. I discussed which global health agencies are addressing the problem and also found 2 research articles that would help address the issue. Learning objective number 2 supports patients and clients in preventing disease, maintaining wellness, promoting and restoring health, and advocating for death with dignity. I chose an assignment from Nursing 4540, Nursing Practice Care Community. The assignment is Community Practicum Teaching Plan. The goal met I gave myself was 100%. During this assignment, I discussed and provided information for dialysis patients to be able to maintain their health during natural disasters. I also was able to create a teaching plan to educate everyone on a patient teaching level. Objective number 3 evaluates patient-centered care for patients and clients across the lifespan based on a common and complex health needs, and compromise multiple health states when considering multiple determinants of health. Course number 4620, Compromise Multiple Health States. I chose the CBSL assignment and PowerPoint. The goal I gave myself was 100%. During this assignment, I discussed congestive heart failure and was able to research and provide information where support groups, help with treatment, and websites for patient education to all patients with all income levels. Objective number 4 synthesizes clinical and judgment in nursing practice utilizing critical thinking, nursing process, research, and evidence-based practice. I chose assignment Quantitative Research Article Submission Activity from Nursing 4391, Evidence-Based Practice and Nursing Inquiry. I gave myself 100%. During this assignment, it allowed me to use my critical thinking and also evidence-based practice to search through articles to find a solid evidence-based practice research article to use towards my research. Objective number 5 employs safe, effective, patient-centered care using theories and evidence-based findings in collaboration with patients, clients, and members of the interprofessional and intraprofessional healthcare team. I chose the Ethical Dilemmas APA paper out of Nursing Theories mini course, and I gave myself 100% on the goal. During this assignment, I was able to discuss the ethical dilemma that I was faced as an LVN given an assignment that I felt was out of my scope of practice. As an LVN, I'm not able to start a blood transfusion, and one of my patients assigned to me needed 3 units of blood transfused. As an RN, they're able to initiate the transfusion, but an LVN cannot. I brought this dilemma to my charge nurse and the house supervisor and discussed how it would be safer for an RN to have this patient. So in terms, we decided that it would be safer patient care if we changed the assignment. So in that example, I was able to collaborate with healthcare members. Learning objective number 6 differentiates multiple role dimensions and practices within ethical, legal, and regulatory parameters when caring for patients and clients as a member of the interprofessional and intraprofessional healthcare team. I chose, once again, Nursing Theories Mini, this time the Differentiated Essential Competencies, or DEC, formal paper. The goal met that I gave myself was 98%. In this assignment, I was able to research the competencies, which include members of profession, provider of patient-centered care, patient safety advocate, and members of the healthcare team. I was also able to research the legal and ethical terms towards the DECs and better educate myself. Objective number 7 demonstrates professional integrity, effective communication, active inquiry, and service to the community. I chose an assignment out of Nursing 4540, Nursing Practice Care of Community. I chose the Practicum Teaching Plan and Video. The goal I gave myself was 100%. During this assignment, I was able to research dialysis and the dialysis patient's needs in depth, including the medication needs, diet needs, and everything that a dialysis patient needs to be educated on. I was also able to find resources out in the community that every patient would be able to access no matter what their income level is. I also was able to create a video geared toward patient teaching. My 5-year career plan consists of obtaining my Bachelor's of Science of Nursing in May of 2019. I also plan to help open up the trauma ICU at HCA Houston Healthcare Kingwood, which is where I currently work, in the CV Neurosurgical ICU. We are becoming a trauma center, expecting to start taking traumas June of 2019, and I'm excited to help open up the trauma ICU. I also plan to obtain my CCRN and CNRN by 2020 and join another organization within my hospital. My main goal by the end of the 5 years is to enroll in a nurse practitioner program with focus in critical care. This is my capstone and 5-year plan, and I hope you enjoyed. Thank you.